Hi, I'm Dr. Albert Chung and welcome to your friendly proctologist. In this channel we discuss the health of your bottom end and I hope you can relate or learn a thing or two. Please like and subscribe. It greatly helps this channel to grow and I want more people just like you to learn about your own bodies and to give helpful and useful information to understand how your body works and to help yourself through difficult times. Today I wanted to talk about another piece of equipment that I use on a regular basis. It's called a hemorrhoid ligator, or frequently called a rubber band ligator. This instrument, which I'm going to show you, is used typically in the office setting. So after I see a patient, we may discuss about a treatment option for his or her hemorrhoids and say that, you know what, your hemorrhoids would be a great candidate for a procedure to treat them. And what this procedure does is once the doctor identifies a particular hemorrhoid, that can be shrunken down, because again we know that hemorrhoids, when they get bigger, they cause more problems. So if we can shrink them down, then they can bleed less, swell less, and cause less issues, right? And that's what this instrument does. It actually will suck up hemorrhoids into the mouth of the tool, and then we put a rubber band, a very small, very tight rubber band, to cut off the blood supply to the hemorrhoid. And that's what makes the hemorrhoid die and then fall off, and then all of a sudden you've got smaller hemorrhoids which make the patient feel better. So let me show you that piece of equipment, okay? So here we go. I'm holding on to a little nozzle here. Bring it closer for you to look at. And it's kind of shaped like a pistol, right? Like a gun. And you have the handle here. You have a trigger which you can pull back. And as you notice, this sleeve right here is moving when I pull the trigger. There is a rubber band that's placed at the beginning of the procedure, and this is why it's called a rubber band ligator, because the rubber band, which is used on one patient, is placed over the hemorrhoid that's sucked into the mouth here, which I'll explain a little bit more. But this sleeve then will kick off the rubber band and then allow it to snap on to that hemorrhoid that's sucked into the instrument. Okay? So that's the basics of what it looks like. So how does it work then, right? Well, you have a vacuum instrument, sort of like a vacuum cleaner. Well, sort of like the action of a vacuum cleaner. It sucks in air. And you put a vacuum tube right onto the end of this nozzle. So the suction will then be transmitted through this instrument and then to the mouth here. So if I had a vacuum on, it will be sucking onto my skin. It will be puckering up my skin. It will be like kissing my palm here, right? It would be sucking it off. Once I locate a hemorrhoid that needs to be worked on, I then will place this onto the hemorrhoid, and then the hemorrhoid will be sucked into the mouth. And if I were to show you the mouth here, you can see that there's a space in here for the hemorrhoid to go into, right? And when that hemorrhoid is sucked in, that's when I then allow that rubber band to come off. It gets snapped onto the bottom of the hemorrhoid, and then I pull this instrument off. You're left with a hemorrhoid with a rubber band on top, and then after about 2 to 3 days typically, or maybe less, the rubber band will fall out. It will fall off into your poop. along with that dead hemorrhoid that it was caught with. And then your hemorrhoids will have a wound to heal, and typically about anywhere from 7 to 10 days you may have some bleeding there until the wound completely heals where that hemorrhoid used to be. And from there you would see your doctor again to see how things are going and whether you need or don't need another rubber band treatment, all depending of course on your symptoms and how you're feeling and whether things have gotten better or not. Now when you see this being used in the office, I just want to show you one more thing. So this is the anoscope here, right? And we've talked about this, and this allows you to look inside the anus. And so you can see my hand here, right? So if you can imagine, this is placed into your bottom end. This rubber band instrument would then be placed into the hole like so, and then under direct visualization, while the surgeon can see everything, that's where the rubber band will be targeted and then treated, right? Hemorrhoids cannot be banded without this guy, okay? It's a red flag if you ever hear or are suggested by any healthcare worker to have a hemorrhoid banded without seeing anything. If you can imagine, your hemorrhoids are on the inside of your anus. If someone is trying to just do it from out here, no way are you going to be able to see anything, number one, and no way do you know which hemorrhoid you're getting. So definitely make sure they're using some type of viewing instrument like a scope. This is an anoscope. Otherwise you may be in for a little bit of a problem, such as pain or not having the right hemorrhoid treated at all, and so you'd be wasting your time and your money. I only mention that because I've heard stories from patients, from people, clinicians doing this procedure that way all the time, and I think that is absolutely incorrect. Thank you so much for letting me take your time, and I appreciate you watching the video today. There are definitely more videos coming up soon, and I wanted to share this world, this field of colon rectal surgery or proctology out into the public so people know and can be educated on it. Thanks so much again. I'll see you next time. Bye-bye.